let me introduce myself. I'm Dr. Pablo from Spain, from Madrid, and here you have Ohad, who is the clinical director of Alma Laser. So we are going to introduce today a new device which has just been launched today. We call it the Soprano Titanium. You probably know the technology of the super hair removal, the motion technique, who help us to destroy those stem cells in the bulb and in the bulge area by accumulation of heat. So just start with the practice. We have a patient here we choose a very large area because it's also one of the difference we are going to see between this device and the previous ones from Soprano. A back who is a big area. We are talking about probably 1,800 centimeters square. So this is a grid of 600 centimeters square, a regular A4 folder. I've seen in many videos that the people walk too fast and do like that. This is not effective. And if you stay too long time in the same area, it can be painful and even risky. So the idea is to move quite quick, but not too much to lose the energy in a large area and not too small to lose efficacy. So treatment, you see, we program the device, his 600 centimeter square grid. We program the joules, 8 joules with a device like this one, 10 joules, is more than enough, or is the one the company has proved in many clinical studies. So you see, we started with 80 seconds of treatment, and the device is reducing this timing. To work in super hair removal, so in this motion technique, doesn't mean that we cannot work also on a regular stacking. We call it HR technique, so the traditional 1 per 1 in a 3 hertz, so 3 shoots per second. Evidently, you're going to think like me that it could be more efficacy to do it in a traditional way rather than in an accumulative, in a motion way. And it's not true. So the motion way is extremely efficacy. Evidently, if the patient has thinner hair, it can be more efficacy. You're going to have more absorption by the traditional one. But in the traditional, we have also some limitation. Limitation on the skin type. Here in the motion, we can treat phototype 1, 2, 3, 4, 5, 6. With the stacking one, if we want to treat a higher than phototype 3, phototype 4, 5, 6, we need to decrease the energy or to increase the pulse duration. In both situations, the result won't be the same one because we are sacrificing the efficacy to have more safety. So the pulse duration, as you know, is related with the, when we do the stacking technique, to the thickness of the hair, the difference of color between the hair and the skin. So if we need to have an average of timing of treatments, the whole back of a large back like this one can take us around a maximum of 4 or 5 minutes. Total, the arms will take us around 3 minutes each one, all the 360 degrees. The legs will take us around 2 minutes and a half, the frontal part, and another 2 minutes and a half, the posterior part. So we are talking about treatments between 3 and 5 minutes in extremely large areas. We can cover the full body in less than 25 minutes.
So I've just finished the second grid, and as you can know, I'm not working very fast, okay? And I'm not putting a lot of pressure on the skin, but I want to maintain full contact. And that's very, very important to the success of the procedure, okay? And you can see that the speed that I'm working in, I'm not working very fast. I'm working at this pace, finishing the area, going back to square one, and then back again. Finished, going back to the beginning. I could do it like this. It will give me the same result, same homogeneous result, but then I'll be very tired after a few grids. Here, I'm not putting any fatigue, any tiredness to the procedure. It's very easy for me, 80 seconds. So now we have the third grid within 81 seconds. That's actually 3.5 minutes, Pablo, for the whole back.
We didn't talk about other things like control of the device by the software, but it's the first device I have in my clinic where I can receive in real time in my computer or in my telephone the information about the treatment who is doing in my clinic at this moment. And if I have 10 devices, the 10 devices will report me immediately who the area who has been treated, the time, the number, the energy is spent. So, and all this information is statistically studied by the software, and I have immediately, whenever I want, information about all the treatments done in my clinic, even if I'm not in my clinic.
So we can change into SHR stack mode.
Okay. We are going to decrease the. Sorry, ready? Yeah.
Yeah.
We're going to. Okay. Once we apply the same one, if you want.
We can do 3 stacks of 7 joules.
Okay. A bit less because the area is smaller. Okay. So, Okay.
Yeah.
7 and okay.
3 stacks.
Okay.
Exactly.
Okay. We start. So the device calculated automatically 21 joules per centimeter square with the parameters we say 3 stacks, boom, 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 one after the other one with 7 joules centimeter square total fluence.
So I'm just treating the NEP, which is the final part of the back that wasn't included in the grids, and it's that simple. And a second pass just to be sure, and to get a more homogeneous cover. And we are done also with the smaller area. So this handpiece is the trio. Okay, it's the same mechanism, 3 wavelengths, like Dr. Naranjo has explained, but the spot size here is smaller, and this enables us to treat smaller areas. And this is why we have 2 connectors in the soprano titanium. So I can take that handpiece and treat smaller areas than than I would treat usually. And what I like to do is to challenge the platform into super-sized small areas by adding the facial tip.
Okay. The facial tip,
So
yes.
can you turn around?
Just to show you you have also a very extremely adapter for very, very small areas.
Yeah.
Okay.
So now we've actually changed the spot size from 2 centimeters into 6 millimeters.
Okay.
And you can see here in the stack mode, you have the option for facial tip. On the left bar.
Just a second. Okay. Here.
So now we're sorry. No, it's not here. So we're just pulsing two stacks, okay, with the amount of fluence that I wish to get a very fine treatment to the area. Can we have the close the goggles, the white goggles?
The white, yeah.
Yeah, let's change. And now we're going to treat with the very, very, very small areas of glabella, facial areas. We can treat mustache, ears, etc.
Done.
Again, adding a very small amount of gel.
Facial tips.
Exactly.
Okay.
And then stand by, moving to ready mode.
Okay, go.
If there's any questions from the audience.
If there are no other questions, then I think we should proceed. Thank you very much.
Thank you very much. Thank you.